Microdosing GLP-1 medications involves taking a smaller than prescribed dose, either once a weekly or every 4 days, to reduce side effects. This approach must be done under the guidance of a healthcare provider to ensure safety and effectiveness. While microdosing is easier when the medication is available in a vial, many patients receive their GLP-1 medications in auto-injector pens, which present unique challenges. Understanding GLP-1 auto-injector pens. GLP-1 auto-injector pens have revolutionized medication administration by offering a convenient, pre-filled, single-use method for delivering precise doses without the need for manual measurements. These pens consist of several key components: a protective cap, a lock, charge-unlock feature to prevent accidental injections, a short and thin needle designed for subcutaneous delivery, a plunger or spring-loaded mechanism for automated injection, and a dose indicator that confirms medication delivery. They are typically supplied in packs of 4, preloaded with specific doses such as 2.5 milligrams, 5 milligrams, or 10 milligrams. One major limitation of auto-injector pens is their inability to allow for dose adjustments, which makes microdosing challenging. Since they are designed to deliver the full preset dose, patients seeking gradual dose escalation to minimize side effects may find these pens restrictive. Alternative approaches such as transferring medication to a sterile vial or using compounded GLP-1 formulations offer greater flexibility. Understanding how to properly manage and utilize these pens ensures both safety and effectiveness in GLP-1 therapy. Always consult your healthcare provider before modifying your medication routine. What is microdosing GLP-1? Microdosing GLP-1 involves taking a smaller than prescribed amount of medication, typically once weekly or every 4 days, to gradually introduce the drug into the system and reduce side effects such as nausea, vomiting, and gastrointestinal discomfort. This method allows the body to adjust more smoothly and may enhance medication tolerance over time. However, microdosing must always be done under medical supervision to ensure safety and efficacy. The issue with microdosing and dose splitting. Microdosing and dose splitting pose several challenges, particularly when using auto-injector pens. These pens are designed to deliver the entire pre-measured dose in a single injection, making it impossible to administer only a fraction of the medication. Unlike vials, which allow for precise dosing adjustments, auto-injector pens do not have a mechanism to control the amount injected once activated. Attempting to use only part of the dose from an auto-injector pen can lead to medication waste, dosing inaccuracies, and potential contamination risks. Some patients attempt to work around this limitation by extracting medication from the auto-injector pen into a sterile vial. This method enables controlled microdosing but requires precision to maintain sterility and avoid dosage errors. Using a compounded version of GLP-1 medications in vials can be a more practical alternative for those needing gradual dose adjustments. Ultimately, patients should work closely with their healthcare provider to ensure safe and effective medication management when considering microdosing. Understanding the risks and proper methods for dose modification is essential to achieving optimal therapeutic outcomes while minimizing side effects. Alternative approach: transferring medication to a vial. Since the pens do not allow dose customization, some patients attempt to extract the medication and transfer it to a separate sterile vial. This method allows for precise dose adjustments, but must be done correctly to prevent medication loss or contamination. Compounded versions of GLP-1 medications in vials offer an easier way to microdose. Safe method for extracting and transferring medication. Extracting and transferring medication from an auto-injector pen to a sterile vial is a meticulous process that must be conducted under proper conditions to ensure safety and accuracy. The primary goal is to maintain sterility while minimizing medication loss and preventing dosage errors. This method allows for controlled microdosing and more flexible dose titration, which can be beneficial for individuals adjusting their GLP-1 medication regimen. Below is a detailed guide to safely extracting and transferring medication from an auto-injector pen. Supplies needed. To safely extract and transfer medication, gather the following supplies: a sterile vial from a reputable source, e.g. Amazon, for storing extracted medication, insulin or tuberculin syringes with minimal dead space to minimize waste, alcohol swabs for surface disinfection, gloves for hygiene, an auto-injector pen like Trulicity, Zepbound or Wegovy for extraction, a Sharps container for proper disposal of used needles and syringes, and a sterile needle to ensure accurate medication transfer from the syringe to the vial. These tools help maintain sterility and safety throughout the medication handling process. Why use an auto-injector pen? Auto-injector pens simplify the process of administering GLP-1 medications, making it more convenient and less daunting. These devices are pre-filled, eliminating the need to draw up medication, which can be a tricky and error-prone task. The pens are designed to deliver precise doses, ensuring that you receive the exact amount of medication prescribed by your healthcare provider. This accuracy helps to optimize the effectiveness of your treatment while minimizing potential side effects. One of the key advantages of auto-injector pens is their user-friendly design. With clearly marked dosage settings and an intuitive injection mechanism, they are accessible even to those who may be unfamiliar with giving injections. The process is straightforward. Set the dosage, clean the injection site, and press the button to administer the medication. Most pens are equipped with safety features to prevent accidental needle sticks and ensure proper needle disposal. Comfort is another important factor. Auto-injector pens often come with fine, thin needles that make the injection process less painful. Additionally, the speed and consistency of the injection can be adjusted, further enhancing comfort. By reducing the complexity and discomfort associated with injections, auto-injector pens can improve adherence to your medication regimen, thereby supporting better health outcomes. Preparing for microdosing. Before you start microdosing GLP-1 medications, consultation with a healthcare professional is essential. They will offer personalized guidance, help determine the appropriate microdose, and monitor your progress. After receiving their advice, gather the necessary supplies: your GLP-1 auto-injector pen, alcohol wipes, and a disposal container for used pens. Begin by washing your hands thoroughly to ensure cleanliness. Next, check the expiration date on your GLP-1 auto-injector pen and inspect it for any signs of damage or contamination. Follow the storage instructions to maintain the medication's efficacy, whether it requires refrigeration or a cool, dry place. Understand the specific instructions that come with your auto-injector pen. Familiarize yourself with how to set the dosage, which may vary slightly depending on the pen's design. Make sure to practice setting the dose before your first injection to build confidence. Prepare the injection site by cleaning it with an alcohol wipe. Common areas for injection include the abdomen, thigh, or upper arm. Rotating sites with each dose helps to minimize discomfort and prevent tissue damage. Keep your supplies organized and within reach to streamline the process. Lastly, ensure you have a safe method for disposing of used pens and needles. Use a designated disposal container to prevent any accidental injuries and follow local guidelines for disposal. Proper preparation is key to a successful and safe microdosing experience. Step-by-step extraction process. Before beginning the process of extracting and transferring medication, gather all necessary supplies and prepare your work area to maintain a sterile environment. First, ensure your hands are thoroughly cleaned with Purell or soap and water to minimize contamination risks. Although optional, wearing gloves is recommended to enhance hygiene. Begin by wiping the sterile vial's top with an alcohol swab to prevent contamination. Arrange all your supplies meticulously on a clean, dry surface, which includes a suitable syringe, either insulin or tuberculin, designed with low dead space to minimize medication waste. To prepare the syringe, pull back the plunger beyond the intended volume. For instance, 0.8 milliliters if planning to inject 0.5 milliliters to facilitate controlled and precise extraction. As you prepare to extract the medication from the auto-injector pen, first remove its cap. Then, align the syringe needle with the pen's internal needle opening. Holding both firmly, activate the auto-injector's trigger, allowing medication to transfer fully into the syringe, ensuring that you achieve an accurate dose. Once the medication is in the syringe, it's time to transfer it to a sterile vial. Attach a clean needle to the syringe to prevent cross-contamination and carefully insert the needle into the sterile vial. Inject the medication gently and at a controlled pace to ensure complete transfer without wastage. Once done, cap the vial securely and store it following the manufacturer's guidelines. Once the extraction and transfer are complete, focus on storage and disposal. Dispose of all used needles and syringes in a shop's container to prevent injury and contamination. Label the vial accurately with the extraction date and dosage details to avoid confusion or dosing errors in the future. Store the labeled vial in a cool, dry place as indicated in the medication guidelines. These steps ensure safety, sterility, and accuracy throughout the process. Benefits of this method. This method allows for precise dose customization, enabling patients to microdose or stack doses as directed by their healthcare provider. It helps minimize medication waste, preventing costly losses from spills or damaged needles. By maintaining sterility, it reduces the risk of contamination and ensures safe medication administration. Additionally, transferring medication into a vial provides better control over dosage adjustments, allowing for a more tailored and effective treatment plan. While auto-injector pens are designed for single-use doses, transferring the medication to a sterile vial is a viable option for patients needing dose adjustments. This method, when done correctly, ensures safe and efficient use of GLP-1 medications. Microdosing is best achieved when medication is in vial form, as it allows for easier titration and better management of side effects. If you're considering this approach, consult with your healthcare provider to ensure it aligns with your treatment plan. Stay safe and informed when handling your medications.